Today we're going to talk about what ovulation is, how to identify signs that you're ovulating, tests that you can do to prove that you're ovulating. Let's get started. I'm Dr. Sharon Moayeri, owner and founder of OC Fertility. One misconception in infertility is that if you're having normal menstrual cycles, you must be ovulating. That's true for a lot of patients, but at least 10%, and sometimes higher in certain populations, may not be ovulating, and so it's good to be able to prove that you are ovulating. So patients who should be double checking that they're ovulating, even with normal menstrual cycles, are those patients with a condition formerly called PCOS or polycystic ovary syndrome, now called PMOS or polyendocrine metabolic ovarian syndrome. Sometimes they may have normal cycles, but up to 20% of the time they may not be actually ovulating, or at least not ovulating normally. Other patients, perhaps older patients or very young patients, so patients who are in their late 30s or in their 40s, may have what they describe as normal menstrual cycles but don't ovulate necessarily regularly. These are things that you want to prove in terms of ovulation with either symptoms and/or tests. So the first question to answer is, what is ovulation? A lot of people don't realize that we're born with all our eggs, and those eggs are residing in the ovary in an immature state. We're shedding lots of eggs every month, but only one gets recruited to ovulate every month, assuming that you are ovulating normally. So you have a lot of these eggs wanting the job, but only one will get it. And what happens during puberty is one of those eggs has the opportunity to mature, and once that egg matures, it ovulates, and that means it gets released from the ovary and has the opportunity to meet sperm in the fallopian tube and actually get fertilized. So most of the eggs in our ovary actually don't ever have the chance to ovulate or be fertilized. Only the one that ovulates every month has that chance. Typically, for a woman who has a 28-day cycle, which is what most people learn about, that occurs somewhere around day 14, and if the egg does not get fertilized and implant in the uterine lining, then a woman will have her period. So in fact, your period comes after failure of ovulation to cause a pregnancy. A lot of people don't realize that. So first you ovulate. If you don't have a pregnancy, then you'll get your period after ovulation, typically 2 weeks after ovulation. So that part of the menstrual cycle is pretty fixed. Ovulation, 2 weeks later, if you're not pregnant, you get a period. The part leading up to ovulation can vary between women depending on how long their cycles are. So for a woman who has a 28-day cycle, leading up to ovulation typically is going to be about 14 days. But for a woman who has a 35-day cycle length, meaning from one period to the next, it might take her 21 days to ovulate. In other words, to build up the egg to maturity. And then if she ovulates on day 21 and doesn't get pregnant, then 2 weeks later she'll get her period. The length of time it takes to build an egg or to ovulate does not affect whether or not she can conceive, but she may not know when to have intercourse or when to time things if she's trying to predict when's the optimal time for fertility, because an egg has a very short window for fertilization. Once the egg is released during ovulation, it has 12 to 24 hours to get fertilized. So the time leading up to ovulation is your most fertile window. The day the ovulation occurs and the next day are your most fertile days. So the few days, 5 to 7 days leading up to ovulation are your most fertile days because sperm can last a few days in the reproductive tract. So even though the egg only has a 12 to 24 hour window for survival, we want the sperm to be present ahead of time. I would say the egg is like the queen. It comes out, it wants the sperm already waiting for it. So it's best to have sperm there before the egg is released, given the short lifespan of the egg. So tracking your ovulation can be helpful, that knowing that women don't always ovulate on day 14 is important, and recognizing that ovulation occurs 14 days before your period is really how you track when ovulation is likely to happen. And if you want to use a calendar for that, it can be useful. And then the other thing to know is that having intercourse at least once or twice a week, you're likely to pick up on ovulation timing, but you have to prove that you're actually ovulating for that to be meaningful. So what can you look for to identify whether or not you're ovulating? You can start with simple things and some signs or things in your body that tell you that you're ovulating. The more common things are the slippery mucus discharge that women get vaginally. It's usually this clear, slimy kind of discharge that occurs right around the time of ovulation. That's very common. The other thing women might notice is breast tenderness. Increased libido is very common. Sometimes women will notice some bloating or cramping around the time of ovulation. Not having bloating or cramping is not a negative sign, but some women will notice that more often than not. There's actually a term for that. It's called Mittelschmerz. So ovulatory pain is not uncommon for women, but not necessary either. Having those symptoms doesn't prove that you're ovulating. Sometimes the follicle can grow and start to mature the egg, but people can have ovulatory problems where they recruit the follicle to mature the egg, but actually never release the egg. So just because you have some of these symptoms doesn't prove that you're necessarily ovulating, because ovulatory disorders can come at different points of the process. So what could be some warning signs that you're not ovulating? So having irregular cycles, meaning having your period come fewer than every 21 days or taking longer than every 35 days. Those aren't always proof that you're not ovulating, but they could be warning signs. Having sporadic menstrual cycles, meaning no pattern to your periods, is definitely a warning sign for being anovulatory or not ovulating. The other thing to look for is other signs of endocrine or metabolic disorders. So having other signs of either hormonal or metabolic dysfunction, such as excess hair growth on your face or your body, where we don't expect to see that for women, acne, especially adult onset acne, and if it's new, having maybe signs of thyroid dysfunction, maybe your metabolism has changed or you're intolerant of temperature. That could also be a sign of being anovulatory. And lastly, if you've been trying to conceive for at least 6 to 12 months and you're not getting pregnant, that could be an indication that you may not be ovulating. So what are some of the ways you can track ovulation? We talked about some of the signs you can look for, so things like the mucus change, your body's signals that you are ovulating, but that's not really proof. So if you wanted to prove that you're ovulating at home, you could do ovulation predictor kits. There's the simple ones that you can just pee on that tell you yes or no. So if you're using an ovulation predictor kit, what they're actually measuring typically is just your LH or luteinizing hormone. That surges when you're getting ready to ovulate within the next 12 to 24 hours. And that's your most fertile window. So I like ovulation predictor kits because they're actionable and it gives you an ideal window of fertility. When you get a positive on your ovulation predictor kit, that day and the next day are your 2 most fertile days. So it tells you when to have intercourse essentially. Now, you don't have to use it, but if you use it a few times, it can kind of narrow down your normal ovulatory window, and then you don't have to keep tracking it, which sometimes can get stressful for some people. There are also some kits that give you a high and a peak value. The high is typically tracking estradiol or estrogen in your blood, because estrogen rises before your LH, which is the actual ovulatory hormone, LH. So it lets you know that roughly 5 to 7 day window prior to your LH surge. So it gives you a little bit of a longer window for attempting intercourse. So you can have cumulative attempts prior to ovulation, especially if anyone has travel or you might not be together. It gives you a little bit more window time. So there are other kits that also track progesterone rise after ovulation, which we expect to see progesterone rise after ovulation to 3 when you've completed ovulation, and then what we call mid-luteal, which is a week after ovulation when implantation occurs. Ideally, you want to see that around 10. Again, it depends on the scale that these kits are using and whether it's a urinary test or blood test, so it's more complicated than that. So these kits that you order direct to consumer will give you their scale, but it allows you to generally see the estrogen pre-ovulation going up, the LH surge around ovulation, and then the progesterone rise after ovulation. And that's the pattern that you're going to be looking for to prove that you're ovulating. Once you get an LH surge, 2 weeks later is when you'd want to check for pregnancy, ideally 10 to 14 days later. Some pregnancy tests can be done sooner, but I encourage patients to double check, even if they have a negative. Wait until 10 to 14 days to be sure, because sometimes the HCG, which is your pregnancy hormone, might start out a little bit low, and you just want to make sure that you track it all the way to 14 days after you have a positive LH surge. So how else can you track for ovulation? We talked about the cervical mucus change. That's another tool you can use. This sometimes is more observable for some women than others, and so if you are able to track it, you're looking for kind of a sticky, stretchy, clear fluid that's discharged right around the time of ovulation. The third thing to look for, which is kind of an old school way of tracking ovulation, is what's called the basal body temperature. I've never been a huge fan of basal body temperature in the past because it can be very stressful for patients, and it's telling you after the fact. Basal body temperature is tracking your rise in progesterone with the concomitant bump in your temperature when that happens. So it's really not an actionable thing, but it does tell you that you've ovulated. In the old days, patients would take their temperature in the mornings and then track it on some sort of graph or chart. Nowadays, you have these devices that you can wear, such as an Oura ring. The nice thing about the wearable devices is that the information is gathered passively and then translated for the patients. They're not having to check their temperature every day and then take that information into some sort of other chart or graph, and I like that much more than the patient having to check their temperature every day. Some patients will come in and talk about fertility apps, which can be useful, although you have to be careful with the fertility apps because, again, they're tracking your menstrual cycles, which don't prove that you're ovulating necessarily. So again, they might tell you that you're having normal menstrual cycles, but that doesn't prove whether or not you're ovulating unless you use that in combination or in conjunction with some sort of ovulatory device, either your LH kits or ovulation predictor kits, or like I mentioned, the wearable device. Maybe some signs or symptoms of proof of ovulation, which again is not a hormonal proof of ovulation, so it's incomplete. So one of the last things we're going to talk about is proof of ovulation through fertility testing, directly through your doctor's office with ultrasound and or blood work to prove that you're actually ovulating. So if you're really unsure and you've tried, the at-home ovulatory predictor kits, you've tried the wearable devices, you've tracked your symptoms and signs, and you're still not sure, or you just want more evidence or more details, then seeing a reproductive endocrinologist or your OBGYN can help you identify the pattern of ovulation more accurately through pelvic ultrasound and blood tests, sometimes even saliva tests. These tests can identify your actual ovulatory patterns and consistency with accuracy. The other thing I tell patients is just because you don't ovulate every cycle doesn't mean that you have an ovulatory disorder. So people who have demonstrated ovulation most of the months, I always say you're entitled to have a couple months out of the year where things are off. That can be related to travel, to stress, that's very normal. But if that becomes a more frequent pattern, then it's probably not just a random fluke, it's probably a disorder. So what are some of the biggest ovulation myths? One is that women ovulate on the same day, irrespective of their periods. So a lot of people think that a woman ovulates on day 14, no matter what, but that varies from woman to woman, and it can even vary within the same woman between 1 and 3 days. So roughly speaking, if you have a 28-day cycle, you probably ovulate somewhere around day 14, but that can still shift between 1 and 3 days on average. So to be safe, if you're trying to conceive, again, you can use the tools that we talked about, or have intercourse once or twice a week and make sure that you're capturing ovulation that way, if you've already proven that you are ovulating. Myth number 2 is that if you're having normal periods, that you're definitely ovulating. That's often the case, but not necessarily universally the case. So we know that normal periods are a sign of ovulation, but at least 10%, if not up to 20% of women who are having normal periods may not be ovulating regularly. So it definitely warrants seeking medical attention if you're not getting pregnant and or if you're not having routine signs of ovulation that we discussed earlier, especially if you've tried using those tests and or wearables and you haven't been able to prove ovulation consistently. Myth number 3 is that you must feel when you're ovulating. Not everyone feels it, and not feeling it doesn't mean that you're not ovulating either. Some women feel it, some women don't feel it, and neither one is an indication of a problem. So when should you be concerned and when should you seek help regarding ovulation? Again, if you're younger than 35 and you haven't been getting pregnant despite having regular intercourse, after 12 months you definitely should seek help. If you're older than 35, you should seek help after 6 months. There might be reasons to seek help sooner if you're having irregular cycles, any other metabolic signs of excess hair growth, acne, cold or hot intolerance, if you're having repeat miscarriages. These are reasons to seek medical attention sooner. So I'm curious to know what methods you're using to track ovulation. Please leave your comments below, and if you have any questions about fertility, please let us know. We might feature it in our next video.